Hi friends, I'm Dr.Priti Vyas from Sangeeta Hospital, Andheri West. I'm going to talk to you about what is infertility. I've been working in this place for last 20 years. I started my practice way back in 1999. And I've been seeing in all these years from the days where I used to have maybe two or three infertile couples every 2-3 days to now I see at least a good 3 to 4 infertile couples every day. And these I'm talking about the new patients coming every day. So you can realize that how the infertility has increased so much. And why is it? I mean, what is so difficult? Why are people finding it so difficult to have babies now? Is it something to do with the environment? Is it something to do with their lifestyle? Is it something to do with the men, the women? I mean, it's such a mystery. So, what is infertility? When a couple is married and is already trying to have a child for more than a year and is not able to conceive, is when they get labeled as infertile. So, if a couple comes to me within just 2 months of trying for pregnancy and says, "Oh my God, doc, I'm not able to have a baby," then I tell them to relax. We explain to them what are the good days, what are the fertile days, and tell them to just go back and enjoy life, because that's not infertility. Infertility is when they've been trying for more than a year and still not able to get pregnant. Now, this can be an issue with either the male partner or the female partner, or sometimes both are normal but just not able to get pregnant. So, with the male partner, of course, it's the most easy to try and pick up if there's something wrong. It's just a simple semen analysis where they have to give the sample of the semen for a lab test. And that will tell us whether the count is good, whether the sperms are motile enough, whether they are energetic enough, whether they are normal enough. And if there is something wrong, then obviously we try and treat that. With the female, there can be so many things that can go wrong. It can be a problem with some kind of an infection, maybe there's a blockage of the tube. Sometimes we have polycystic ovaries, sometimes we have ovarian cysts, sometimes we have fibroids, sometimes we have endometriosis. Sometimes it is everything which is normal, means we get the entire battery of investigations done and we just can't find a reason. Sometimes it's a hormonal issue. I mean, that's so common nowadays to get some hormones which are disturbed and are not able to let the woman get pregnant. So when a woman walks into our clinic with an issue of infertility, what all do we do? We of course take a detailed history, we examine them, we do an internal examination, and then we tell them to just get some basic tests done. There are certain basic hormones that we do, like the thyroid, the prolactin, the anti-Mullerian hormone, and maybe some more tests which are for routine, like a blood test, a CBC, a sugar test. We make sure that we check their BMI. We need to be sure that we are ruling out polycystic ovaries. If the patient has irregular cycles, then it goes more in favor of a patient having PCOD, and that is the reason why she is not able to get pregnant. Then we ask them to even get a sonography done, because that will tell us if there are fibroids or endometriosis or some cyst in the ovary that we need to operate on. If everything is found to be normal, then we have to either counsel the patient, or sometimes we have to start treatment. This depends a lot on how long they've been married for, what is the age of the patient, how soon do they want to get pregnant. Sometimes we need to operate on them, especially if there's a fibroid or endometriosis or cyst. So we need to first repair what is wrong, and then maybe they'll just get pregnant on their own once the repair is done, or sometimes they will need some more treatment. And what all treatments can we offer for an infertile couple? So it can be just counseling, telling them what the good days are, or it can be a little beyond that, where we give them some tablets, some medicine, some injections to make the eggs grow, monitor how the eggs are growing, and then ask them to have relations after. Sometimes we go a step further where we do IUI. What is IUI? It's intrauterine insemination. So that is where the husband's sperm sample is taken, it's washed, concentrated, the good quality sperms are taken out, and that is inserted inside the uterine cavity around the time of ovulation for the woman. And then if that fails, we of course have IVF in hand. IVF of course becomes a much higher treatment, but we must remember that there is always hope. Take care, friends. So friends, I see you next week again. Join us on the YouTube channel. Next time, I'm going to talk on emergency contraception. Commonly, we call it the I pill. Definitely do listen to me. Bye. Take care. If you like our video, please subscribe, like, and share our videos. And if you want, you can press the bell button that will help you to get the fresh updates every week.